ومن الجدير بالذكر أن للباحث مشاركات تطوعية في خدمة المجتمع، وعلى رأسها تعليم القرآن في حلقات التحفيظ. أيضا له مشاركات في النشاطات المختلفة في الكلية والجامعة، فليتفضل الباحث مشكورا.
أولا بسم الله الرحمن الرحيم، الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. أشكر من الجميع حضورهم اليوم ودعمهم ومساندتهم لي. أما بالنسبة عن الموضوع اللي سأتكلم عنه اليوم، فالموضوع هو عبارة عن أثر المشوهات الجينية. هناك بعض المواد التي تسبب تشوهات جينية وتسمى المشوهات الجينية. فموضوع اليوم يتكلم عن أثر هذه المشوهات على المرحلة الأولى من مراحل الجنين، وما ينتج منها عند ولادة الجنين. سأتكلم عنها إن شاء الله. سأغطي عن أنواع هذه المشوهات، وأيضا سأتكلم عن بعض التشوهات الجينية وأين تحصل في جسم الإنسان. فبسم الله الرحمن الرحيم. سيكون البحث باللغة الإنجليزية، وإن شاء الله إن كان في نهاية البحث أن أعرض ملخص عن ما ذكرته في هذا التقديم باللغة العربية. فعلى بركة الله نبدأ. First of all, this subject is about the unborn babies in the first period of pregnancy. So it's about the first period of pregnancy, and the subject, I will divide the subject into 4 main points. The first point which I'll talk about is the introduction about this subject. I will define the difficult terms in it, and I will mention the importance of this subject. Why is it important to know these teratogenes or that cause birth defects? And then I will go to the types of teratogenes, and then we will go to birth defects, and finally we will summarize what have we mentioned in this presentation. But before we start, we would like to cover these objectives that are shown on in the slide. By the end of the presentation, we will know the importance of the embryonic period, and we can identify teratogenes and classify them, and also know the abnormality that form from teratogenes, and finally we can define birth defects and its classification and where it can occur. Bismillah, nabda with the first point, which is the introduction. I think that anyone who would read the title of this presentation, which is the role of teratogenes on developing embryo, he will ask himself, what is a teratogene? What's an embryo? So let's start clarifying these terms. As for a teratogene, a teratogene is an agent or a factor that is found in the environment. Environment is full of factors and that may benefit humans or harm them. So teratogenes are agents that are found in the environment, which if the pregnant mother is exposed to during her pregnancy, her infant will most likely be born with a birth defect. So that's basically what a teratogene is. As for the embryo, as I've said earlier, that this subject is about the first period of pregnancy. Pregnancy is divided to periods. As for the first period, it starts from the beginning of pregnancy, from fertilization, until the end of the 8th week. This period is called the embryonic period, and the fertilized egg in this period is referred to as an embryo. So that basically is what an embryo. And as you see here in this picture, this is an embryo in its late stages in the embryonic period. And this period is characterized, or what makes it special is that the formation of organs occurs in this period. As for the importance of this subject, why is it important to know these teratogenes? Are they that important? Are we always exposed to it? So many studies shows that more than 100,000 infant is born each year with a birth defect. More than 100,000. It's a big number. And most of these babies or infants who are born with these birth defects usually don't live up long to see the second year. They die from the first year of their life. And also up until now, there are 4,000 known birth defects. It's a large number of birth defects. So that's why it's important to know these teratogenes. Also, the relationship between these teratogenes and the embryonic period is one of the important things to know of this subject. The embryonic period is considered the most sensitive period in pregnancy, mainly because of two factors. The first factor is there's a connection established in this period between the mother and the embryo. When the embryo is implanted in the uterus of the mother, there's a connection between the mother's blood and the embryo. So any chemical or any factor that will affect the mother, it will also be transmitted to the embryo. So that's the first factor in the sensitivity. As for the second factor, that as I said before, this period is the period where the formation of organs takes place in. So, as you see here in this picture, the embryonic period starts from the beginning of pregnancy until the 8th week. So all of the organs of the body start forming in this period. So if an embryo is exposed to a teratogene, it will affect the formation of these organs, as we will see in the next point. Let's move to the second point, which is the types of teratogenes. Basically, teratogenes are classified to 4 types. The first type is infectious agents, like viruses and bacteria, that cause infection to humans. And the second type is physical agents, like radiation, trauma, heat, etc. As for the third type is chemical agents. And finally, hormones that is found in the mother's body. It also can cause a birth defect. So now I will mention an example or two on each type of these teratogenes. As for the infectious agents, herpes virus and HIV virus, as you see in the picture, are considered to be one of the teratogenes that cause birth defects to an infant. So if the mother has this virus while she is pregnant, her infant will most likely be born with a birth defect. As for the second type, the physical agents, an example is X-ray and hypothermia. I think most of you know what X-ray is, radiation. And hypothermia is extensive heat. So these agents can cause also birth defects to an infant. As for the third type, which is chemical agents like alcohol and thalidomide. Thalidomide is a medicine. There are many drugs that can cause birth defects, so that's why a pregnant woman is advised to not take some of the drugs while she is pregnant. And also smoking is considered to be one of the chemical agents that causes birth defect as well. As for the final type, which is the hormones, like hormones secreted from the pituitary gland or adrenal gland or other glands of the human body, if the mother is a diabetic mother which has diabetes, or the mother is obese, has the hormones of her body will take an effect on the infant as well. Now we'll move to the third point, which is birth defects. We will define them and we will mention where it can be located in or takes location in, and also its types. As for a birth defect, the birth defect is a disorder. A disorder, which means not normal, abnormality. There are many types of disorders, but usually birth defects cause malformational disorders, which means wrong formation of organs. Malformation means wrong formation. So it causes deformation, it causes the organ to not form well. So it can either be structure or function or metabolism or behavior of the organ. So will be present at birth. So, as you see here, that birth defects can be either structure, function, or in the metabolism or behavior. But we will classify them as where it takes place in the human body, because many of them are in the structure and function as well, and in the metabolism. So it's kind of a mixture. But we will mention birth defects as where it took place in the human body. And mainly, it takes place, the birth defect takes place in 4 locations in the human body. The first location is the cardiovascular systems, which is the heart and vessels. And the second location is the nervous system, which is the brain.
عفوا أخوي فهد الوقت قارب على الانتهاء.
طيب. Which is the nervous system, and the third location is the limbs, and finally in the GIT, which is the gastrointestinal tract, like stomach, esophagus, and etc. And now we will take an example on each location. As for the cardiovascular system, patent ductus arteriosus is considered one of the common birth defects. It's a failure in closure of one of the ducts of the heart. That is a major duct in the fetal period, but it's closed normally after giving birth. As for the nervous system, spina bifida is one of the common birth defects as well. It is an opening in the vertebral column, as you see in the picture, that the spinal cord and some of the spinal fluid will come out of. As for the limbs, we have here phocomelia, which is shortness of the limbs. The limbs will be shorter than normal. And finally, in the gastrointestinal tract, we have atresia, which is, atresia can occur in many places in the gastrointestinal tract. But what you see here is the esophageal atresia, which happens in the esophagus. And finally, now we will summarize what has been said in this presentation, and I will summarize it in Arabic. So, في البداية أهمية معرفة المرحلة الجنينية الأولى أنها المرحلة التي تتكون فيها الأعضاء. فلسلامة هذه الأعضاء لكي تتكون بشكل صحيح لازم أن يجب على الأم الحامل أن تتجنب الوقوع في التعرض لهذه المشوهات الجينية. أما بالنسبة للمشوهات الجينية فهي توجد في البيئة، قد يكون الإنسان يتعرض لها دائما فيجب الحذر منها، وهي أساسا 4 أنواع، إما تكون عوامل معدية أو كيميائية أو فيزيائية أو تكون
أخوي فهد الوقت لو تكرمت.
هذا آخر شيء، هذه النهاية. بالنسبة للتشوهات الجينية كما ذكرت أنها تحدث في أحد 4 أماكن رئيسية من الجسم، إما في القلب أو في الجهاز الدموي أو الجهاز العصبي أو في القناة الهضمية أو في الأطراف. هذا ملخص عن الموضوع. أشكر لكم استماعكم وأتمنى أن لا أكون أطلت عليكم.
أشكر لك. نأخذ مداخلة من قسم الرجال، ولو تكرمت إليت المداخلات